Hi, myself Dr. Pooja Bansal, consultant gynecologist at Nerul, Navi Mumbai. So today we're going to discuss about natural induction of labor. That means what can I do to induce labor? Why the induction of labor is needed? If I am at term, I'm 38 weeks or 39 weeks of pregnancy and I want to go in labor by myself without any interference from the doctor, I can do certain things to aggravate the chances of labor. Now the first thing is to reduce anxiety. As I know that as we go closer to the due date, the anxiety level is very high. What's going to happen? Will I be able to take the pain? Will I be able to go through the natural process of labor and birthing? So too many questions in mind, too many confusing answers, that all creates a lot of anxiety. So we try to reduce anxiety levels, because if you high in anxiety, the possibility that the hormone which is released by labor will never release. So that's the reason. The first thing is doing a breathing exercises, certain kind of meditation or yoga will reduce the anxiety level. Now the next thing is exercise. The most important thing I focus over throughout 9 months is make my patients active, because if you're active, the possibility and chances of you going in labor naturally is higher. So as basic as walking can really increase the chances of labor. Walking causes descent of the baby head that presses over the cervix, opens up the pelvis, and has a higher chance of getting into labor. The other exercises including squats, cat and camel, butterfly, or ball exercises in the end of pregnancy can be very, very helpful to cause labor. Now if we are active, definitely the all other symptoms also get to reduce, and you may have lesser pains and aches while pregnancy. The other thing which can cause the stimulation of uterine contraction is the nipple stimulation. Now that's not a very commonly used method, but it's a very scientifically proven that nipple stimulation of a woman who is around at term releases the hormone called oxytocin, and it can have the induction of labor or chances of going in labor faster than anybody else. Now how do you do that? You try to try to copy how the baby sucks postpartum, how the baby take the feed from the mother. It's a reflex, like they're stimulating the nipple, they're stimulating the areola with your hand or with using the manual pump. You can do that maybe 5 minutes each breast each day, can give rise to the induction of labor. The other commonly used method, which has no significant scientific background, is consumption of castor oil. Now, consumption of castor oil causes gastric irritation, it causes loose motion. With that, it causes irritation of the uterine muscles too, and can induce labor, but it's not a very scientifically proven method to induce labor. The other method could be sexual intercourse. Definitely, at the end of pregnancy, if a woman who is sexually active can go in labor faster, because the sperms or the semen contain prostaglandin, and that can give rise to labor induction. Beside all that, certain people do use process like acupuncture, massaging points, that could be also helpful, but does not have any scientific background. So for my patients, definitely I recommend everybody to start on exercises way early in pregnancy, and if you're too late, at least start on walking and ball exercises to induce labor. Thank you so much.